As a women's health professional, you get it. You already know the value of menstrual cycle tracking. But I'm guessing that you're not entirely comfortable interpreting complex charts, weird mucus patterns, abnormal bleeding, or other similar and unusual situations. You're passionate about fertility awareness and you want to use it in your practice, but you're not sure where to start. And this is where FAMM comes in. Registration is now open for our Fertility Awareness Mastery Mentorship Program. The next class starts in a few short weeks. We're starting on the 26th of March, 2025. By the time you finish your FAMM certification, you'll have the skills to confidently teach fertility awareness to your clients, interpret all kinds of complex charting scenarios, and you'll have the step-by-step protocols you need to help your clients improve their hormone and menstrual cycle health. Registration is only open for a short time, so apply today at fertilityfriday.com/FAMMlive. That's fertilityfriday.com/FAMMLIVE. Transform your practice in 9 months. Join us in FAMM. Again, that's fertilityfriday.com/FAMMLIVE. This is the Fertility Friday podcast, episode number 565. Today, I'm sharing another brand new episode in our FAMM Practitioner series. I'm sharing my interview with Feven. She is one of our practitioners, and today's interview is just jam-packed with so much information. She shares her personal experience of birth and how that really transformed her understanding of birth, challenged a lot of her ideas, and even ultimately led her to switch professions. And also how it all intersects with fertility awareness knowledge. So very, very powerful and impactful episode that I'm really excited to share with you. But before we get into it, let me share a little bit about Feven. Feven Binega-Northcott is a birth, postpartum, and lactation educator, as well as a fertility awareness method practitioner in training based in Bermuda. With over 17 years of experience as a Montessori early years educator and a passion for working with families from pregnancy through early childhood, she brings a holistic and evidence-based approach to reproductive health. Since founding Harmony Birth Services in 2009, Feven has supported over 1,000 families through birth, postpartum, and infant feeding. She left the classroom in 2021 to focus full-time on birth and lactation education, and is also a certified hypnobirthing teacher and trainer of childbirth professionals through Childbirth International. During the height of the pandemic in 2020, she co-founded the Doula Difference alongside 2 colleagues and helped establish the grassroots Bermuda Association for Allied Birth Professionals to strengthen the local birth community. In 2024, Feven expanded her work in women's health by launching Wise Cycles, a program dedicated to supporting reproductive well-being, whether for conception, contraception, or hormonal balance. So without further ado, let's go ahead and jump into today's episode. And I'm excited to be here today with Feven. Welcome to the show.
Thank you. I'm so excited.
I'm so excited to
myself.
have you. Well, it's funny because you said that when I sent the email to invite your cohort to jump on the podcast, that you saw the email and you didn't think it was actually happening.
I was like, that can't possibly be for me. So I ignored it, and then it came again the second time, and I was like, oh, maybe.
Yeah. Well, I say it all the time. I really do love these episodes, and as we were talking a little bit in the pre-chat, I feel like our listeners who enjoy our FAMM Practitioner series, I feel like they appreciate the authenticity and just the realness of our conversations, and to kind of satisfy that curiosity. I mean, for me, I love being able to ask these questions, learn more than even in every time that I do these interviews, even though at this point, you and I have spent many months together and we've had many sessions together, I always feel like I learned something new. So really excited for today. So let's go ahead and start with one of my favorite questions to ask on these episodes, which is, let us know when you had your first period and what that was like. And I would love to hear a little bit about your journey through your reproductive history, whether that involves contraceptives or not, and ultimately what led you to where you are now with the fertility awareness aspect to your practice?
Right. So I was 12 and a bit when I first had my first period. And having grown with a house full of women and older siblings who were mostly girls, I was kind of anticipating and thinking that it's any day now, any month now. So it wasn't particularly a surprise. And being the highly independent, younger sibling, I just handled it and went on my business. And then it was maybe, I think, 3-4 months until my immediate older sibling, like, you have your period and you never told us? I was like, yeah, what is there to tell? Just normal. And just as a background, I was born and raised in Ethiopia, in Addis. So I guess the culture and the coming of age culture and aspect of reproductive health is a little bit different to, I guess, the landscape that I'm in right now, or I have been in over the last 20 plus years. So it was just a kind of a normal, I guess normal depends for a lot of people, but it was pretty straightforward. I was unaware that you can have period pains and mood swings and all of the things that a lot of the people that now we work with either normalize or that's part of their lived in experience. So fast forward, I started having children quite early for this part of the world. I was 22 when I had my son, and with no prior use of contraceptives for a couple of reasons. One, it was culturally not acceptable for a girl to go on and seek hormonal contraceptives. So I managed just, avoiding pregnancy to that point. And then I had my son. I moved to Bermuda from Ethiopia, where the culture and just the way birth and just parenting was very, very different to what I grew up in. So the birth experience itself was very unexpected, surprising. As it's not anymore, but it was very traumatic. So I went into that early parenting experience very confused, not understanding why my body failed me. And really, for both my husband and I, just rethinking whether or not we'll have more children. And then I had my first experience with hormonal contraceptives just about 8 weeks after I had my son. Obviously, we did not want to get pregnant. And I had severe reactions to it, both from a lot of weight gain that wasn't there when I was pregnant, just a lot of changes with mood and depression, whether it was compounded by the fact that I was in a completely different culture and with a lot of support, nonetheless, was really, really tricky. So because it was the most common denominator, I was like, well, we're not doing that again. This did not work. I went back to what I knew before, which was not necessarily the in-depth fertility awareness method where I was charting and taking my temperature, but having an awareness of the rhythm of my kind of reproductive health. And then in my early 30s to late 30s, I was having lots and lots of issues around leading up to my period, where it ended up being kind of almost 2 weeks of where I was severely depressed, or I felt like this doom and gloom, and as if like someone died, and there were no reasons for all of that happening. So I saw my physician, who was really progressive and proactive at that time, and she mentioned that it's the hormones, and but again, it was normalized. This is normal, and I guess knowing what I know now, I go through stages of anger and just disbelief, like this is not normal. But I was led to believe that this was normal. And so those episodes kind of slowed down towards my late 30s. And I actually discovered you that I read the fifth vital sign, and kind of in between that phase, after having my son, and when we eventually thought, okay, maybe we can give a second child a chance. And we did things completely differently. We went to a childbirth education class, specifically to attempt a vaginal birth after a cesarean. We hired a doula and just, took charge and responsibility for the experience that we really wanted to have. And I, with my husband's support and my doula support, had successful vaginal birth after a cesarean, after being told once a cesarean, always a cesarean. And, you can't see me, but I'm 4'11". So you're tiny, your husband's tall, your pelvis. But anyway, so we kind of defied the odds, and we weren't the only couple who achieved vaginal birth after cesarean. So for a small island of Bermuda, there were 6 couples within, close to 6 sessions that were attempted and succeeded in having a vaginal birth. And kind of my entry into that reproductive health, women's health landscape started as I was pushing my daughter out. And I looked at my doula and I said, I really want to do what you do, because this is cool. So in 2009, I founded Harmony Birth Services, became a certified birth doula. I took my daughter while she was breastfeeding, the doula training. And then I think, kind of to answer your question, like how did I get here? It was kind of the series of events where I was working with clients, and I would reflect and say, what was missing and what was out of my scope, and what was the most pressing challenge that my clients were having, or my friends who were having children at that time that was not either easily addressed by the system that we have. Is there a better option? So that kind of the entry was having my own transformative birth experience, but seeing that being possible for other people, and then kind of entering that field. So soon after becoming a doula, I became a childbirth educator, and then I was supporting clients in their breastfeeding journey, and I was like, well, I need to do better, and became a lactation counselor, a postpartum doula. So kind of went on, and then became a trainer of other birth professionals. I still am. So somewhere during my training as a childbirth educator, I came across your work and Lily Little's work, because it was talking about prenatal and pregnancy nutrition. So my children remember, because, as a busy parent yourself, you would know there's not a lot of time for sitting down and reading a book, but I'm so grateful for audiobooks, because I would listen to your book on audio and Lily's book, and I would listen to your podcast. And again, kind of that for me, the stage of learning is, again, anger and frustration that this is not part of the mainstream education for our girls and boys, because they have, they need to know. And then this belief is like, and kind of applying it to what was happening with me in my 30s, and thinking, wow, well, if I can share this information with just another person, how amazing would that be? So I trolled you for years. And the same with Lily, and that, your
I
work.
feel like I want to interject and say you did not troll, because troll has that negative connotation. I feel like you
gotcha.
stopped.
I stopped. And because I work and live in a small island community of 60,000 plus people, we rely heavily on international best practices and professionals like yourself who are doing amazing work in that field. So we both became my highly recommended reading and resource for my clients and friends and whoever was interested. So I remember getting your email. I think it might have been in the height of the pandemic in 2020 about this practitioner training. And I thought, I'm going to put that in my professional development goal. And for whatever reason, lots was happening in my life at that point. I was leaving the classroom where I had been teaching for 17 years as an early childhood educator and kind of doing the birth work full time. You know what that's like as a self-employed person. So kind of the stars didn't align until last year when the email came out again and I said, yeah, I'm ready. And I remember messaging you. I don't know if it was through an Instagram DM or an email to say, well, what qualifies as a kind of women's health practitioner? I'm a doula, childbirth educator. Would that qualify? And he said, yes, apply. And kind of the rest is history. It feels like a long time ago, except, it's been a few months. And little did I know that I was going to be put through the same process that we put our clients. And so, I guess I was slightly cocky, if I'm honest. It was like, oh, I know my body. I know, I have a 28-day cycle. I've read your book and I've heard your podcast, and this is kind of a good learning for me as I'm working with clients. A lot of kind of the narratives that have been ingrained over several years take time to undo. So yeah, so where do I start in terms of the program itself? I'm going to point fingers at you.
Can I interject for a minute? Before you jump into all of that, I want to thank you for taking us through, because I feel like you just took us through, I don't know, like 10, 15 years plus of your life. And of course, that's one of the reasons I love starting with that question, because we just get to sit and listen to your story. And I really appreciate you sharing all of that. Because like I said, I just said it, we've been together for such a long time, but it was really, really nice for me to hear your personal experience and connection to this work and the different ways that your experience has kind of led you to where you are. And I feel like it really enriches my understanding of why you're so passionate about these topics, because you had a very unique and profound experience. So a few aspects of your story that stood out. I mean, you mentioned that you had your first child, you had your son when you were young, on the younger side. Now, I grew up in a small town, so, lots of people were getting married before around the same time as you. So although I live in Canada, so I don't have the same, cultural experience, it definitely, I don't know if there's a difference overall about the small town versus the big city. I suspect there might be, but that to me is actually not that young, but I understand that it really varies depending on what your experience has been. But what you shared about just not being prepared for birth, not having that information, not necessarily having had a lot of those questions answered, even though you experienced your first period, knew that it was coming, took care of it on your own, didn't seek support. So in some ways, you were very well educated about certain things, or at least you felt like that way. And in other ways, just not very much. Did you want to tell us a little bit more about that?
Yeah, so I think when I tell people about my journey, the way I describe how my husband and I approached our first birth was we were naive. And so I come from a culture and actually newly arrived in Bermuda. So was just this belief that birth is normal. Everyone does it. It's a normal physiological process. And the people that are looking after me, did my best interest. And so we did attend the childbirth class. We learned about the process, but nothing really prepared us to navigate the system. And by system, I mean the very heavily obstetric-led system that sees birth and the process and pregnancy as this medical event that needs to be managed every step of the way. And yeah, that we were not prepared for. And so, and I take full responsibility, and part of where I am right now, maybe the reason why I do the work that I do and that I have done over the years is because of that experience, and that has value in that. But yeah, so, I came from a place where I remember hearing and trying to find I don't know what the word in English is, but, women having their babies at home and hearing the kind of the signal that the baby has arrived, and women cheering and ululating, and just that being a part of my soundtrack. And I'm of the generation of kind of millennials where everything kind of became, because of the political landscape and where Ethiopia was at that time, I'm kind of the last of the generation to see this very holistic and, traditional wisdom, whereas the generation after me hasn't had that experience. So that was my perspective, and that was kind of the lens that I was seeing my own experience. Come to find out that I was kind of navigating a different system.
As a women's health professional, you get it. You already know the value of menstrual cycle tracking. But I'm guessing that you're not entirely comfortable interpreting complex charts, weird mucus patterns, abnormal bleeding, or other similar and unusual situations. You're passionate about fertility awareness and you want to use it in your practice, but you're not sure where to start. And this is where FAMM comes in. Registration is now open for our Fertility Awareness Mastery Mentorship Program. The next class starts in a few short weeks. We're starting on the 26th of March, 2025. By the time you finish your FAMM certification, you'll have the skills to confidently teach fertility awareness to your clients, interpret all kinds of complex charting scenarios, and you'll have the step-by-step protocols you need to help your clients improve their hormone and menstrual cycle health. Registration is only open for a short time, so apply today at fertilityfriday.com/FAMMlive. That's fertilityfriday.com/FAMMLIVE. Transform your practice in 9 months. Join us in FAMM. Again, that's fertilityfriday.com/FAMMLIVE. Now let's go ahead and jump back into today's episode. I feel like I look back and I feel so fortunate that for whatever reason, I came into a lot of this knowledge quite young. I remember having a conversation around the time that you had your first son with one of my girlfriends. And I remember that I was telling her how I was planning to have a home birth, and I was not married. I was certainly not ready to have a child, but and it's because I had come across these different literature. I have this book still on my bookshelf, Misconceptions. And they had a whole conversation around the issues with the kind of obstetric overarching scenario with birth, particularly in the United States. And of course, Ricky Lake's documentary, The Business of Being Born. I don't remember exactly how old I was when that came out. I think that was quite a bit maybe later, but I feel very fortunate to have had some of that exposure. And so in your case, you kind of literally just crashed into this reality of what birth is considered here. And something you said really struck out to me because, your experience of birth, you mentioned that it was so traumatic that you didn't even know if you wanted to do it again. And that is very, very profound that was your experience. And I'm sure that you're not the only one, especially for women who have children young. I've heard that it can be you wouldn't be the first person who has described an experience like that to me. And I feel like I have heard for a lot of young women, very young, before they've ever had any conversations around it, even. It's kind of just a mystery, what's going to happen now.
Yeah.
Yes. And then your experience with birth control. So you were crashed into, and it's interesting, in class, we were literally talking about this exact topic because we were, all of our practitioners in your group are now doing their practicum. And so this topic did come up in class for a client, who was approaching some of the same experiences in that sense where, this client had a cesarean birth and now they're wanting to have a vaginal birth after delivery. And I think it might have been a different client that you were talking about who, we always have to talk about what happens at that 6-week appointment because that's, of course, when they're wanting to get everyone on hormonal contraceptives. Yeah, those things really struck me because, this was presented as the only alternative. I feel like that's really the heart of what we're trying to do here with the work that you do and the work that I do. We're trying to put a stop to this kind of like, this is the only way. Like I don't focus primarily on birth, but obviously that is a topic that has come up a lot. There's not only one way to birth, and there's certainly not only one way to prevent pregnancy.
So I professionally and personally, I've gone through various stages of growth and just trying to understand and having the best possible outcome, collective outcome for all of us. And now I'm done having children. So I have a 16-year-old daughter and, my son who's a grown up now. And so I want them to have a better experience. And from being angry at the system and being highly critical at the system, now I'm counseling clients and women and families about showing them the limitations. And there's a subtle difference. So when you understand the limitations of a professional, if it's an obstetrician, that is the lens that they see things in. And unless they've done specific training and they've told you otherwise, that is the scope of their work. So you can expect that, a highly trained surgeon and whose work has lots of value and relevance. And when it's relevant, you can't expect them to do the work that we do and to sit there for 45 to an hour holding hands and kind of unpacking these things. So you're definitely not going to a shoemaker to get a dress made. So just trying to get people to understand the limitations of the people that they're working with so that they can manage their expectations. So there isn't either a blame, what has, my body failed me, or this person didn't do their job. So if we understand and have realistic expectations of what we're getting into, then that I find that that's empowering, and that is a good common ground to get to work with professionals that are in the field. Because if I'm going to go to talk to an OBGYN and say, and this and birth control, and this is, they're humans, they get attacked. Whereas, I understand this is what you do, and my work can coexist side by side, and we can work together. And that means that our clients win.
Mm-hmm. Yeah. I feel like it takes a lot of experience and some maturity to come to those conclusions. You mentioned a number of times just the stages. I don't know if we would call it the stages of grief, but the stages of something that you go through when you learn this information. And that has been one of the most consistent responses that I have heard from just doing the podcast, from working with so many women over the years. They're angry. We're always pissed at the beginning, because why shouldn't we be? It's really aggravating because, you're kind of caught up in this, the information is so life-changing, and you all of a sudden, this very important part, your reproductive cycle, your reproductive hormones, just understanding how they work. It's such an essential part of your life as a female, just from the perspective of being a woman of reproductive age, navigating relationships, navigating contraception, navigating building your family when you're going to have your children, and what that experience is going to be like. It is just this essential part of our lives, regardless of how it looks. Everyone's experience of this looks different, but it's still a very essential part of our lives. And yeah, we know nothing. We're taught nothing. And then when you learn about it, it's amazing, because now you just have all this information, everything makes sense, and you're kind of on this high until you are just like, well, wait a minute, why wasn't I told this before? And then of course the anger steps in. So I do feel, I resonate with what you're saying, because I would say that there just are these stages of maturity and growth. So I often joke that, if I didn't have a podcast, I would just be standing on the street corner with a sign and just screaming with my head off, because I've heard so many stories. Fortunately, I've been able to share the stories on the podcast, so I don't have to hold the weight of all of it just by myself. This is why I share the FAMM Practitioner series, and I've done the Pill Reality series in the past, where there's a lot of, for anyone who's listened to those episodes, if you want to feel angry, just read the pill chapter, go listen to those episodes, and then wallow in it for a little while. But we can't stay in that angry place all the time. And when you're working with clients, as you said, it's not the Feven and Lisa show. Our clients have multifaceted health needs, and we need a team. I've always said that we need to have a team. And that means we have to be able to play nice in the sandbox. And in order to do that, we're not pretending.
Yeah.
We have to have respect for the doctors, I think. Sit with it for a second, because I know some people are like, but, sit with this. They went to med school and they were trained in a specific way. And exactly what you were saying, Feven, we have to understand what that modality is and what the limitations of it are. And we have to be really clear on the fact that that one modality is not the everything modality, where this person is going to have the answers to every question. They're going to be able to support you in their specialized area of, their skill set, what exactly they were trained and the perspective that they were trained in. So definitely resonate with with what you were saying there in a big way. And I think that's part of the reason why we've had such a good time together in the program, because I feel like we see eye to eye on a lot of these things. And it just comes with having, it just shows like you've had many, many interactions. And so you're not going to get anywhere if you go in with aggression and anger. You have to actually get to a place where you can respect their knowledge and skill set and recognize the limitations, just like there are limitations to our knowledge and skill set. Because of course, we don't specialize in every possible thing on earth. I'm not a chiropractor. So,
right.
So, just as one example, I'm also not an optometrist, right? Like I'm not a dentist either. So there's we have to be respectful of the limitations of whatever our knowledge base is.
Absolutely.
Yeah. I could go on for days on that one, but that was something maybe for the newer, I don't know if newer listeners, maybe some of our listeners who are fairly new to this knowledge, maybe even within their professional scope, they've just kind of more recently discovered charting. What are some of your top recommendations for managing those feelings of anger and frustration? Like, tell us a little bit more about just how you work through all that.
Time. Time heals
all wounds.
Yes. And just, time, it does a few things. It gives you time to percolate but also professionally, I'm not unique in that there have been cases of, client cases that had me like scratching my head. Why, they did all the things. And obviously, my role as their doula or childbirth educator or lactation counselor is not to tell them what to do. I don't prescribe, but I give them information and resources based on what they said is important to them and what they're looking for. And having done all the things, we still had this sticking thing that we couldn't figure out. And there had been a couple of moments in the training where, we talk about things and there's like, and a particular client comes up and it's like, oh, that explains it. And I think I don't think I'm the only practitioner, and all of us go through, this feeling of wanting to fix everything and just having, struggling with things that are unresolved and, the unknown, to have kind of some answers and kind of some like potential reasoning for why certain things turned out the way they did or certain protocols didn't work has been very helpful. So time, and that, having the time to either experience similar situations or having the time to gain new knowledge, I think time is a big thing. But also some kind of self-care practices that through my different trainings, this reflective practice that has been a really big part of the work that I do, and just debriefing and unpacking things that, where is this emotion coming from? Am I bringing my own baggage and my own experience into this client experience, or is this because of what happened? And I've had lots of, great colleagues that I can debrief the experience with and vent with and go into the next client carrying a lot less of that baggage so that, I can focus on them. So time and just self-care practices like journaling and reflecting and having people to debrief with. That's really
Mm-hmm. Yeah, I think I always use this analogy. I think it's a bad one, but I'm full of them. So I remember when I was in high school, I had this friend and he had this dog, and the dog was so old. I don't know how old this dog was because I don't have a dog. And so, I don't know the dog years scenario, but the dog was really, really old, to the point that, you'd be there and someone would be making all this noise and the dog would barely even move, right? It was just like, and then you picture like someone who just got a puppy, right? And the puppy's all like, and like, you just can't even relax. And so this is a terrible analogy. I'll say that again. But I feel like when you first discover fertility awareness, you're like the puppy and you're trying to get everybody to do it. And you're just like, I have to do this right now. And let's change my life. I mean, it's going to change your life too, right? And so what happens with the time, as you mentioned, is that you kind of settle into the knowledge. And I feel like it comes with a little bit of patience. You realize eventually that everyone is going to make the decisions that feel best for them at the time. Once you've been in the field long enough and you've been around, maybe just older, maybe just wiser, I don't know, you realize that everyone comes to things in their own time.
Yeah.
You can't force somebody to do anything at any point. And so sometimes the best way to inspire change is literally by living your life in the way that you feel is best and sharing about what you do and talking about it, as opposed to ramming it down people's throats. So that kind of just talk about what you do and whatever, but not necessarily feeling this attachment that everybody needs to do what I'm doing as well. Because what I found is that people just kind of meander back. And sometimes I often, it's not just once I've had this experience where sometimes the person who's kind of like the most against it, like that's the rhythm method, and it's not scientific, like the people who are just like, you're just like, whoa, wow. Sometimes those are the people that end up, emailing you 2 years later and telling you that they're now certified professionals in the field they were knocking. Yeah. So you just never know how it's going to turn out. So I think that those are some really great words of wisdom, Feven.
Oh, thank you.
I would love to ask you what your experience has been now, because you're very seasoned. You've been in the field for a long time. As you mentioned, your kids are grown now. So the experience that you shared was quite some time ago, and you've since obviously changed careers, which again is very inspiring that you were able to take your challenging experience and really turn it into a better experience for your clients. I can just imagine how many women have had a better experience of birth because of their work with you, and have a different kind of hope and knowledge around what that experience can be like. So share a little bit about your experience in FAMM and how that has what that has done to your practice. I'll just leave it very open-ended for you to kind of share what you found.
So as I said, I was not expecting to put myself through the experience. I'll go back again. Charting? What do you mean? I know when, again, it's the whole, I've grown up, and obviously I came into it a little bit later than some people might have. And so just thinking, detaching from that rhythm method of and charting and really looking at what's happening. And personally, a couple of years ago, I had multiple kind of episodes of kind of unexplained bleeding that wasn't related to my period. So we did all this, ultrasounds, and, we were at some point thinking that it had something to do with my running, because I ran a lot. And it was just, I remember my OB and my GP saying, you're going to be really annoyed because we know you like answers, but we found nothing after doing all of these things. And then about 18 months before I started the program, I had this really, I have like a high pain threshold, and I had this unexplained pain where I had to call my husband to come and get me because I couldn't drive home. And then an ultrasound then found fibroids. And so just it's been really interesting putting myself through some of the protocols and really learning about I've been pretty big kind of nutrition, but just like nutrition 2.0. And again, thinking, oh, I'm a pretty healthy person. I eat healthy foods, but I found out that I was under eating. And Lisa, you're at fault. Again, she's like, coffee. And, you and I had like back and forth banters, and it took me a while to let go of, and understanding how caffeine was impacting just my health and suppressing appetite and all of that. So I think from the outside, for people, my husband and my friends and who know me and as the coffee snob, the biggest change, kind of the biggest visible change is Feven is not having coffee first thing in the morning every single sleeping day. So, I mean, that is a big credit. I hope you understand what that means. But just understanding, again, it's all about building habits and not trying to put myself through all the things that need to be done, and having patience and seeing the difference between each cycle. And so that has been helpful on a personal level. But also now I can work with my clients when they're first coming to me as doula clients, just giving them an idea of, where our work can go. So I'm not saying goodbye to them once we've had our 2 postnatal visits, but then I'm now starting to work with people, getting them into the postpartum period and potentially giving them an option outside of you either have birth control or you risk getting pregnant conversation. And so the way I teach in my childbirth education classes has changed because, again, the way I approach the whole birth education and kind of the physiology and of birth is very much uses how the hormones work as a beautiful orchestra during labor when the right environment is present. So we're looking at the role of hormones in pregnancy, but then that has even enhanced my teaching in that aspect. And when it comes to breastfeeding and just helping clients be proactive and have that information and be a constant source of support. But it also has added another population to my potential client base, is those people who may not necessarily want to get pregnant, but want to have other options of managing their reproductive health, painful periods and PCOS diagnosis and endometriosis and unexplained infertility. So now I get to do this work with women or girls who are having their first period. And working with women who are in my age group, kind of exiting, on the other side. So it's expanding my work with clients, which is really, really powerful and really exciting. And I'm really excited for what the next few years are going to bring.
Mm-hmm. Oh, I love that so much. And there's so much that I could say. One of the coffee thing.
I couldn't not come to this podcast without talking about coffee. I would not be Ethiopian enough.
Oh, that's so awesome. You thought it would be easy. Teach them to chart their menstrual cycles, they said. Help them learn to use the menstrual cycle as a vital sign, they said. And then you saw the charts. You saw things that you didn't even know were possible, and you really don't know how to interpret them. Fortunately, I've created the perfect solution for you. I want to share with you our top resource for women's health professionals, how to interpret virtually any chart your client throws at you. This new resource breaks down complex chart interpretation into an easy step-by-step process. It will give you the tools you need to better support your clients. Head over to fertilityfriday.com/chart to snag your complimentary copy today. That's fertilityfriday.com/chart. Now let's go ahead and jump back into today's episode. Well, I mean, don't be scared. I don't just jump into the class and take away everyone's coffee, but you really touch on one of the really important aspects of FAMM. And I know now that really does make this program quite unique, because we are not looking to just have this, streamlined thing that's really easy for us on the back end. And the way that we structure our assignments, the way that we structure the program our intention is to give our practitioners the best possible experience to help them to learn as much as they can when they're with us. And so one of the philosophies behind that, and this has been, I would say, important to me from the start, because when you jump into this world of fertility awareness, if you haven't spent any time in that space where you're actually tracking things for yourself and noticing what is actually said about those things from an objective standpoint, and if you haven't had the experience of kind of coming to that realization of like, oh my goodness, like what I'm seeing in my cycle might be different to what I thought my cycle was. And then having to actually look at some of your own, behaviors, habits, and things like that. I feel that the reason that we do this as a mentorship is because when you personally had to go through that experience and kind of see for yourself, well, this is her hypothesis. Let me see what happens when I ditch the coffee for a bit. Oh, wow, my cycle really did change. So it's a very humbling experience, I think, for all of us, myself included, because I mean, there's a reason why I teach this way. I've had my own experiences of this as well.
Yeah.
And what happens is I've really found that when you go through that personally, it helps you to relate to your clients on a different level professionally. Because if you don't have that experience yourself, then you may enter that relationship with your client from a very kind of like, I know everything position and I know what's best for you. And then you're just doing a replica of the same system that we've been talking about, that we have issues with. So I feel that the mentorship part is really important, because when you go through it and you face those challenges and you experience, okay, this wasn't just so easy. I didn't just snap my fingers and all of a sudden, everything it was super easy for me to give up it was super easy for me to change my exercise. Like it's very difficult to make these kinds of changes. So I feel that when you go through those things as a practitioner, it does help you to just relate to your clients in a different way, because you're not approaching it thinking, oh, this is just easy. I know exactly what she has to do. Like you don't. You have to kind of work with her to figure out what approach is going to make the most sense. And for the record, I didn't tell you, Feven, you have to stop drinking coffee.
You did not. No.
We talked about coffee as like all of the things. We talked about your cycle. And then we talked about one of the options being considering that, to see what happens. And then ultimately you made that decision and then saw the effects for yourself.
Yeah, definitely. There was no telling. It was more information of like skepticism. Again, those stages of kind of, and then let's try it. And yeah, it was, the proof was in the outcome and on my charts and what I was experiencing. And it kind of opened up opportunities for really interesting conversations with my children and with my husband. My husband now gets excited, when I take my temperature in the morning. He's like, so you have a girlfriend? It's like, what does your temperature say today? Is it higher? And so it makes it opens up lots of conversations and for curiosity from other people. And like you said, the best way to get people interested in what you do is by just doing the work and being yourself. And, to your point about helping you relate, helping us relate to our clients on differently, I think very few professionals can say that about the work that they do. And I think that's kind of a unique thing when it comes to this work that we get to do.
Absolutely. Well, so as we start wrapping up, I mean, I could talk to you for the rest of the afternoon, to be honest with you. But as we start wrapping up,
Invite me again. Sorry.
I know we could do this. We could do this again. We could do this multiple times because this is super fun. But one question as we draw to a close, if there's someone who's listening who's thinking about jumping into FAMM, maybe they had a similar experience to you, as it was, they've been kind of in the community for a while and they're kind of wondering if this is the time. What would you want them to know?
Do it. Just do it. And I say a lot of things about, it's a big time commitment, and it is a big personal commitment, but it's absolutely worth it. Even if you don't, turn it into a business or, an offering that you can offer your client, it gives you so much insight into ways that you can have improved and better enhanced outcomes for your clients, and knowledge that no one can take away from you. If you plan to have children or have children of your own, if you've got girls and boys, you're going to become a completely different parent, in the way that you guide your children. And, until they are old enough to make their own decisions, obviously you're responsible for taking them to a practitioner that you feel will meet their needs. So it would give you different insights into how you approach different conversations around kind of those reproductive health choices that can have, as you and I know, lasting impact in their life. So, I mean, if this worked and the training, and if you've been following Lisa and have read the book, and you're already the right person, because it is not a topic and an area of interest that most people, we're in a very large international community. We're still very small. So if this work and this area of working with women and families and reproductive health was attractive to you, it was because it was the right thing for you to do. So even if you don't do it now, do what I did. I'm not telling you that you can put it in your long-term or medium-term professional development goal, and you will not regret it.
Thank you so much, Feven. Well, so where can people find more about you? And if they happen to be in your local area, where can they tell us all the places and where people can connect with you?
So they can go to my website, harmonybirth.pm, where all of that is, all my work and all of the hats that I wear are in there. And I've also linked in the show notes that you'll have specifically about working together with this fertility awareness method work that I do is called Wise Cycles. So you can find out more about that. I am on Instagram. And so when I have something to say and something worth saying, I'm there. They can also email me. And although this aspect of the work that I'm doing is relatively new, I'm looking forward to working with as many people outside of Bermuda as possible, because internet is great. So yeah, this is where they can find me and learn more about me. I don't feel like I've arrived. I never feel like I've arrived in any of the work that I do. It's an evolving, the more I work with clients, every time I learn something new. So it's my profession, and the work that I do is a work in progress. So follow me to see what comes in.
Mm-hmm. Well, thank you so much, Feven. I absolutely love this conversation. It was so nice to have a chance to chat with you, and I'm really excited to share this episode. I feel like it's just very eye-opening in a variety of different ways. So thank you for sharing your experience and your wisdom and your knowledge.
Thank you. Thank you so much.
And I will see you soon. I'll see you next week.
Yes, next week. All right. Cheers.
Thank you for listening. If you enjoyed today's show, please share with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/565. I hope that you enjoyed today's episode with Feven. I feel like there were so many nuggets, so many fun pieces of information, so much wisdom that she shared from her experience. I was really struck by her birth story, how traumatic it was, to the point that she even questioned if she wanted to have more children, because her experience was just so the opposite of what she thought it was going to be, and how that really shifted her perspective and inspired her to dive into the birth world. And so it's really inspirational to know that that experience has really transformed her own personal goals and career to the point that now she has the wonderful opportunity to shift so many of her clients' experience with birth. So I find that to be really inspirational. One of the things I thought was absolutely hilarious was when she shared that kind of realization when she jumped into the Fertility Awareness Mastery mentorship program, and she realized mentorship meant that she was actually going to participate. And like she said, I'm being put through the same things that I'll be doing with my clients. And she shared how it was a humbling experience. And this is something that many of our practitioners have shared with us because, many of us who work in the field, we certainly have a lot of knowledge. Like you gain so much knowledge and information. But the practice of actually charting your cycles and learning how to kind of move with that rhythm and flow, pun intended, and really understand that this is kind of like a dance. Your body doesn't do what you tell it to just because you tell it to do so. What we're doing when we're tracking is we're actually kind of on the receiving end. We're watching and learning how it's kind of dancing through life and how it's impacted by the various things that come up. And then we kind of learn how we can contribute to pushing that direction, how we want it to go. But you can't kind of just instantly force your cycles to be perfect. And I always talk about this concept of a perfect cycle, how it doesn't exist because we're not robots. And so our cycles are always going to be shifting and changing with what's going on with our lives. And ultimately, the goal is to learn how to kind of like what really is happening in our body. Prior to the charting information, you might be staying out late, you might be drinking alcohol, you might be skipping meals, and you might think that it's totally inconsequential, right? Like you might just feel like, like in your mind, you're like, well, I know that it's kind of like not the best thing to do, but you don't really see a specific outcome of that when you're doing it. But as soon as you start charting in this way and you start to see, oh my goodness, I did this thing and this is how it's impacting me, it really empowers you, not pressure. It doesn't, like I would say, it's not about learning that you need to be perfect and do everything correct all the time, but you start to learn the impact in a very meaningful way. So it doesn't mean you're never going to skip a meal for the rest of your life. I mean, life happens, but now you can be a lot more intentional about how you structure your weeks, your days, your months, because if I do this and if I continue to do this, this is actually how it affects my cycle in real time. And I didn't know that before. And so with that information, I can actually see for myself what's going to work best for my body. And having to go through that as a practitioner, it really helps you to not just understand this stuff from a head knowledge perspective, but it helps you to appreciate how deep it goes. And it also helps you appreciate the challenge of implementation because it's not always easy. Like we often know what we need to do, but it's not like knowing what we need to do causes us to do what we need to do all the time, right? And so similarly, if it takes our practitioners a little while to kind of figure out how they're going to negotiate these things and how they're going to incorporate some of these things in a very similar way, we have to have that patience, understanding, empathy, and, to be that shepherd for our clients to kind of help them navigate that as well. So it's a very interesting, very rewarding process. And I'm really glad that Feven shared a bit of that so that you can kind of see what it's all about. So with that said, I hope that you have a wonderful weekend whenever you're tuning into the show. If you are thinking about jumping in and joining us, you still have a little bit of time. If you're listening to these episodes in real time, you still have a little bit of time to join us in March of 2025. If you're listening in the future, then certainly head over to fertilityfriday.com/FAMMWL to get on the waiting list. And if you're listening in real time and you're wanting more information and to join us in our next group of FAMM, then you can find that information over at fertilityfriday.com/FAMMLIVE. So fertilityfriday.com/FAMMLive. So enjoy the rest of your week or weekend. And until next time, be well and happy charting. And that's a wrap. If you're loving the Fertility Friday podcast, then I know you'll love our Fertility Awareness Mastery Mentorship Program. It's a 9-month immersive experience that will completely transform the way you work with clients, allowing you to not only teach fertility awareness, but to use the menstrual cycle as a vital sign and diagnostic tool in your women's health practice. Our next class starts on the 26th of March, so there's still time to reserve your spot. There's no other program like this offered anywhere. Transform your practice in 9 months. Head over to fertilityfriday.com/FAMMlive to apply now. That's fertilityfriday.com/FAMMlive. Join us in FAMM. This is your year, and we can't wait to have you. Again, that's fertilityfriday.com/FAMMlive.